Good afternoon, everyone. I am the chair of the board, Hermai Zahalai, King County Executive. I call this April special meeting of the King County Regional Homelessness Authority's Governing Board to order. Thank you, Seattle Public Library, for hosting in person at this location today. Thank you all for being here. Affiong, will you please take the roll?
Yes. Chair Zahalai?
Here.
Member Barone?
Here.
Member Fain?
Here.
Member Aviva?
Here.
Member Rink?
Here.
Member Wilson?
Here.
Member Foster?
Here.
Member Bracken?
Here.
Member Hay? Member Prince?
Here.
Member Backus?
Here.
Member Jang?
Here.
Chair, we have quorum.
Thank you. Next is our consent agenda. We have one item on the consent agenda. It is the approval of the February 2026 Governing Board meeting minutes. Is there a motion to approve the February 2026 minutes?
So moved, Chair.
Is there a second?
I second.
Thank you. The motion has been moved and seconded. All those in favor, please say aye.
Aye.
Any opposed?
Aye.
The consent agenda has passed. Now our monthly CEO report from Dr. Kelly Kinnison. Please proceed, Doctor.
Thank you, Chair Zahalai. I want to start by acknowledging the forensic audit evaluation this week that was released this week. The findings in this audit are significant and they deserve a clear and direct response from KCRHA. KCRHA was created during a period of extraordinary challenge in the midst of a global pandemic with a newly formed regional structure and evolving governance. This audit identifies real weaknesses in KCRHA's financial systems, controls, and reporting, particularly during our early formation period. Shortly after I joined KCRHA, it was clear that we needed an independent assessment of those systems. That's why I requested this audit to bring transparency and clarity to where we needed to be. I want to be clear about one important point. The audit did not find evidence of fraud or misuse of funds. The issues identified are how financial information was tracked, reconciled, and reported. These are areas where our systems and processes needed to be stronger. Some of these challenges were driven by early system design decisions, including the use of a contracts management platform that did not integrate effectively with our accounting system. That made tracking and reconciliation more difficult than it should have been. When I joined, transitioning to a more effective system was already underway, and completing that transition to Salesforce-based platform was a critical step forward. At the same time, that transition required significant investment, and decisions that were made in 2023 to count on unspent funds to cover a Salesforce implementation contributed to the 2024 administrative overspend reflected in the audit. It's also important to understand how funds flow through this system. There are no missing funds. KCRHA does not directly hold or distribute funds through its own bank accounts. Payments are made through King County's treasury systems, which provides a clear audit trail for funds distributed and spent. That level of traceability is why the audit was able to identify areas where our internal tracking and reconciliation processes do not align as they should. We know the funds were used on services for people experiencing homelessness, and there is a clear public audit trail of how they were distributed. The issue identified is that our internal systems for tracking and reconciliation did not align. And as CEO, I am accountable for where they are today. I also want to acknowledge and thank the board for the actions they're taking today to strengthen fiscal oversight, including consideration of Member Barone's resolution to establish a finance committee of the board. We welcome that partnership and the additional transparency and accountability it brings. There are clearly areas where our financial systems and controls did not meet standard expected practices of a public agency of this scale, and it's my responsibility to ensure that they do going forward. At the same time, over the past 18 months, we've made meaningful progress. We've strengthened financial reporting, improved invoicing accuracy and timeliness, implemented disciplined monthly fiscal close processes, and improved oversight and accountability. Those improvements are real and reflected back to us by our provider community. The audit makes it clear that more work is required, and we are already acting on that as well. We're addressing the highest risk areas identified in the audit with close partnership of our funders, and will provide a formal response as requested by King County and City of Seattle. I just want to say I'm a career public servant. I was hired to do this work. It's what I've been doing. It is a passion for me. It's part of my identity to uphold the public trust. And I am really honored to be the person that's helping to understand if KCRHA can improve to the level that meets public expectation and scrutiny, and continue to serve the people that we serve every day, including today, who are outside and have nowhere to go. I'll give it back to you, Chair.
Thank you so much. Next is public comment. If you are here with us in person, please sign up to comment with Affiong. If you are providing comment via Zoom, please raise your hand now and you will be called in the order that your hand was received. Each commenter will be able to speak for 2 minutes. Commenters will hear a bell when they have 30 seconds left. Virtual commenters will be muted when their time is up. Public comment will be open for 15 minutes or until no others would like to speak, whichever is sooner. We do ask public commenters to please keep your comments related to items within the board's purview. Affiong, will you please open public comment?
Certainly, Chair. The first person we have in person is Shavana Gaylor.
Hello,
Hello,
all. Hi, my name is Shavana Gaylor. I'm a director with Purpose Dignity Action, PDA, here in Seattle, and my background is mental health. And so I'm here to appeal to all involved that making knee-jerk reactions and a disillusion of any major decisions at this point could possibly impact not only the vulnerable people in our community, but also so many who serve them. I am asking that we implore to look at assessing where we are and what modifications we can make. I get the blessed opportunity of caring for the professional well-being of our team, who are serving tirelessly to support those who are vulnerable in our communities and who are unhoused and who are facing many, many, many barriers. And we're supporting them with identifying those barriers and eliminating those barriers to move towards stability. So when we think about, of course, there are significant concerns that have been that come to mind, and of course we all want accountability and we all want clarity. I'm just appealing on behalf of the community, on behalf of the city, on behalf of the county, and all of the people who it could affect, that we take time to assess and consider the insights from stakeholders and make strategic decisions. Thank you all for hearing me.
Thank you.
Thank you so much.
Thank you, Shavana. Next, we have sort of virtual list. Our first person is Sochi Makovich. Sochi, you are unmuted.
Hi, can you hear me?
Yes.
Hi, my name is Sochi Makovich, and I worked at KCRHA last year. And I think it's important for the public to know that the governing board could have dealt with these fiscal and management issues a year ago. I, along with several other executive team members, filed a complaint about the CEO. My complaint included the fact that she wanted to spend $500,000 on unnecessary positions, even though the agency was $9 million over budget. I talked about how the CEO did not pay attention to the fiscal health of the organization. She did not want to do this audit. The board at no point in time took these concerns seriously. They let the CEO lay off people who filed complaints against her, including the CFO, and they have not replaced the CFO. And I think it's important for the public to understand that this audit is not just a problem with KCRHA leadership, it is also a problem with the board, because the board did not take their fiduciary duty to provide proper oversight. At no point did they set up any channels to ensure they were hearing directly from staff or the general counsel to make sure that they had independent checks and balances. They only relied on the CEO for information. And by also allowing the CEO to retaliate against staff who brought up concerns about the CEO's actions, created an environment where people are not going to raise concerns. They're going to be quiet because they care about their jobs. And what happened? Millions of dollars unaccounted for and mismanaged. And this is just a massive failure of board leadership. And again, this information came to them a year ago. So everyone who was on the board in 2025 is responsible and complicit in this situation.
Next, we have Joe Kruder. Joe, you've been unmuted.
Yes, thank you. Joe Kunzler here, and it's okay. Everybody mispronounces my name or misspells it. It's not the end of the world. I want to thank everyone for your time and commitment to curing our homeless problem. As a regular transit rider, sometimes I see our homeless problem, and I feel horrible as a white man who will inherit a home. I think we need to start addressing white male privilege, and we do that by making sure that we make clear that you don't need to be doing drugs if you're homeless. You need to be given a pathway to a tiny home and a place to stay that's safe, and hopefully a job and self-empowerment and a path to home ownership, and some equity and a handout. What I'm trying to say is a hand up, not a handout. And I think that part of the problem is that we have so many bureaucracies going on. We've got King County Public Health, we've got King County Housing Authority, we've got KCRHA, we've got the city governments, we've got the county government. At some point there needs to be a master and commander who says, this is what we're going to do as the greatest county in Washington State, and build back better and make Vanessa Kritzer proud. And really make sure that Martin Luther King Jr. County lives up to its great name. And I also believe in Mayor Wilson's able to pull this off. And I just really think that whatever happens here, the focus needs to be on housing the homeless now. And I'm saying that as a white man with privilege. Enough is enough. And we don't need to have people drugged out doing drugs. We know drugs are bad for you. That's why we don't do them on this call. We just need to build back better. I hope I gave you some positivity and a sense to go get this job done. Thank you for your public service.
Next, we have Allison Eisinger. Allison, you've been unmuted.
Thank you very much. Can you hear me?
Yes.
Great, thank you. Good afternoon. My name is Allison Eisinger. I'm the director of the Seattle-King County Coalition on Homelessness, whose more than 50 member organizations house, shelter, and care for people experiencing homelessness in King County. Our coalition expects high levels of internal fiscal responsibility and governance oversight so that we and the public can be confident that every public dollar allocated to improve the lives of people experiencing homelessness goes to that end. We support the steps to immediately increase oversight recommended by board members so far, and we call on the governing board to take a deliberate approach that will not disrupt services or harm people experiencing homelessness and the agencies that serve them. Calls to dissolve the agency immediately are not grounded in common sense and would create tremendous instability for people experiencing homelessness and the organizations that do the work. A thoroughly informed plan needs to take shape quickly and must prioritize our region's ability to make secure the federal, state, and other funds currently managed by the KCRHA as our continuum of care. Let me be clear, the establishment of the KCRHA left much to be desired. We do not want to see precipitous or poorly thought through or unsupported actions cause further disruption. Local electeds should prioritize the stability of homelessness services so that the people in our community who need and deserve housing and shelter don't experience disruptions in care, and agencies that provide these services aren't subjected to additional operational strain. We are ready to partner with you to do this, and we expect excellent transparency and sharing of information, as well as consideration of the expertise of the people who are committed to doing this work every day and every night. and the people who themselves receive services. Thank you.
Next, we have Lee King County. Your mic has been unmuted.
Hi, my name is Sam Wolf. I work for Purpose Dignity Action as the Seattle King County Policy Director. I'm here today to urge that we take a thoughtful and measured response to the findings of the audit. Stakeholders have important insights and information that electeds need to be open to hearing before deciding the way forward. Good government principles were ignored early in KCRHA's development. We must not do so again. Regardless of early missteps, we need to think about our present situation, and that situation is incredibly fragile. We're weeks out from the 2026 NOFO. Abrupt action could be catastrophic. We can't risk losing key personnel at a moment where major funding for our local continuum of care hangs in the balance. Our first priority at this moment must be to avoid disruptions in care. This means maintaining our ability to secure funding for critical resources, then proceeding with a deliberate and intentional stakeholdering to ensure that the future of our regional homelessness response is informed by those actively doing the work to support King County's unhoused population. Thank you.
Next, we have Ashley Narovic. Your mic has been unmuted.
Thank you. Hi there, I'm Ashley Nerbovic, representing Purpose Dignity Action. I'm here advocating for a measured and deliberative approach when it comes to the future of KCRHA. If we don't resist this urge to make knee-jerk reactions, we very possibly might make things worse, especially if in our haste to make a change, we end up creating duplicative new bureaucracies and draining our local government funds, while at the same time creating disorganization that could hinder our ability to secure federal dollars. KCRHA staff is just 2 weeks out from the expected notice of funding opportunity, and we're already at risk of losing key personnel at this moment because the agency they work for has been condemned, which is an enormous risk at a critical time. Hasty decision-making resulted in an agency structure at KCRHA that was problematic from day one, and those elected officials are no longer available to take accountability, but we can avoid repeating their mistakes. We must engage stakeholders who have important insights and information that electeds need to be hearing before deciding the way forward. No one experiencing homelessness is going to be served by a disruption in care, and the most effective and prudent course of action is to pause, reassess, and then chart the best course to create stability in our housing continuum of care work. Let's just not hit eject until we know where we're trying to land. So thank you so much.
Next, we have Frederick Heater. Frederick, your mic has been unmuted.
Hello.
We can hear you.
Yes, Executive Zile. My name is Frederick Heater. I'm a disabled veteran for 153 days under your watch. Your contractor, HopeLink, has acted with the callous indifference that created a massive legal liability. You are now on formal notice that the record of administrative negligence is complete. We enrolled in CEA 5 months ago and qualified for priority placement. Instead, HopeLink has burnt through $32,191 to trap my family on a second floor unit. That is per se violation of the federal homestead mandate and ADA Title III. Because of this, Seattle Children's Social Worker has formally referred us to the Washington Medical Legal Partnership. When a hospital must call in lawyers, you have failed your jobs. Prior to our legal notice today, our housing extension was processed legally. However, following a legal notice of intent to sue, HopeLink has failed to send the extension that will keep my family housed for more than 3 more days. This is a legal presumption of retaliation. You are now under housing, using housing as a weapon for a medically fragile child and a disabled veteran. Today, the King County Council Civil Rights Program pierced your immunity. In writing, they regarding primary contractor, they stated, our office does not have jurisdiction. That is absolutely false in King County. That statement is direct evidence of bad faith. I am adding you personally to the lawsuit under RC 496010. Both you and the county have waived sovereign immunity at this point due to gross negligence, and a child on a ventilator is suffering. RCW 424-470 will not protect you from this documented record of bad faith. I'm extending one final olive branch. Make it right today. Give us housing.
Next, we have Elizabeth Malpen. Elizabeth, your mic has been unmuted.
Thank you. I'm Elizabeth Malpen. I am on the Continuum of Care Board for King County. I live in East King County. I have been involved with homelessness since the beginning of the 10-year plan, I believe. I wanted to say that, yes, we need to move with some deliberation. One of the things that I have seen over the years is that it is so easy to just get rid of everybody who was part of something. You lose your institutional knowledge. I think Alexis Mercedes Rink will understand that when we have constant changes of personnel, it's really hard to keep things going and to know why things have been done the way they're done. I also wanted to bring to your attention that one of the documents that you were to read for today on page 15 and 16 shows that the budget for housing was not spent. It shows that only a partial spending of the budget. What happens to that money? We're putting money aside for housing because we desperately need it. Why isn't it being spent for housing? So that's something I'm hoping you will be able to discover. That's all I have to say. I hope that the best will come out of this. Don't throw everybody out. Thank you.
Chair, it's been 15 minutes. We have 2 more people who have their hands raised. Would you like to extend?
Yes, please. Thank you.
So next we have David Haynes. David, you have been unmuted.
Hi, thank you. David Haynes. King County Regional Homeless Authority was originally created to take over the oversight from the conflicts of interest that originated from City Council, who kept watering down the integrity of the oversight in the trade for election support. Yet, the only thing King County Regional Homeless Authority did was guarantee payment after there was failures. And yet, the thing is if you look at the job creations of all the people that got jobs, who keep like raising hell, a lot of it has to do with a tainted scorn lived experience lens, where you got to look through the eye of like a racist, like scorn lived experience from the historical perspective. And it's perverting the efforts. It's like, if you want to solve the homeless crisis right now, you have enough resources where you could use the National Guard to stand up authorized encampments with 24/7 security and service providers to focus people on their drug addiction before you move them or graduate them into a tiny house village, because there's still public health issues with their diseases that they keep spreading around the porta potties and the community kitchens, and innocent homeless people are unnecessarily suffering that. Yet we don't see much of a concerted effort today. All we have is more complaints. And sometimes the small time landlords are complaining about other issues to distract from their restrictions on the comprehensive plan. But the thing is like Seattle is literally running interference for drug pushers. So all your bad policies that are coming out of city council and the county council that run interference for BIPOC repeat offenders that are connected to the criminal underworld drug pushers that use drug addiction as the conscription for guaranteed exemptions from jail. None of those people get questioned to find out where they keep getting the drugs. None of them, because of all their 911 repeat offenses, are required to break their addiction before they voluntarily get to hide behind a door and do free drugs that cause brain.
And lastly, we have Christine Moreland. Christine, you've been unmuted.
Thank you. Can you guys hear me?
Yes.
Great. My name is Christine Moreland. I'm the founder and executive director of The More We Love. I run a crisis center for women and children. I lead street outreach efforts across our region, and I work every day within the systems responding to homelessness, addiction, domestic violence, and human trafficking. Because of that frontline experience, I want to be thoughtful and very clear. We cannot dissolve King County Regional Homeless Authority in the middle of an ongoing crisis and expect better results. Homelessness does not stop at city boundaries, which is why a regional approach matters. We need coordination between cities, counties, service providers, public safety, and outreach teams so people do not fall through the cracks. We also need accountability, measure outcomes, and fiscal responsibility. Every public dollar must be stewarded wisely and tied to real impact. Under Kelly Kinninson, under Dr. Kelly Kinninson, we are seeing the kind of coordinated leadership this agency needs. She's been bringing providers, partners together in more meaningful ways and working to strengthen a system that needs reform, not collapse. The answer is not more disruption. It's to improve what exists, hold it accountable, and support the leadership working to create this real change. This moment calls for courage, collaboration, and results from all of us. Thank you.
Sure. That was our final commenter. We can close public comment now.
Thank you so much. Seeing no further requests, we will close the public comment and move on to our next agenda item, which is a briefing. We're going to be joined by Clark Newber, who will be presenting the results of a forensic evaluation of KCRHA. And as one of the new co-chairs of the board, I just want to take a moment to ground us in the significance of this meeting. I know that there are a lot of eyes on this moment. We have a lot of media professionals. We have service providers who have called in. Our unhoused community, our taxpayers, elected officials are really paying attention here, as they should be. Homelessness is the most urgent challenge facing our region, and the system that we're discussing today is central to how we respond to that challenge. What we are here to listen to and hear about is the result of a forensic evaluation commissioned by the city and the county. This review looks closely at KCRHA's financial management, governance, and internal controls over multiple years. It is intended to help us understand in clear terms what has not been working, what risks exist, and what must be addressed to ensure this system is accountable, transparent, and effective. Our responsibility as a board is to listen carefully, to understand the facts, and to use this information to guide serious, thoughtful action. That means we're going to be asking hard questions. We're going to set a very high standard, and we're going to be focusing on what it will take to deliver a system that truly serves those who are experiencing homelessness and protects taxpayer dollars. With that, I'm going to turn it over to the presenters to walk us through the findings.
Thank you so much. Welcome, and thank you for having me here today at the KCRHA Governing Board meeting. I'd like to specifically thank the members of the Governing Board, as well as stakeholders here and all others that have joined the call. Some of you may know me, but in case not, my name's Mike Nurse. I'm a shareholder at Clark Newber, an accounting firm in Bellevue. I'm a CPA, a certified fraud examiner, and certified in financial forensics by the AICPA, and was the shareholder for this engagement. The purpose for today's meeting is to present a summary of our findings from the KCRHA forensic evaluation. My hope for today is that this presentation will help reinforce your understanding of what you may have heard or read about in the engagement report, which is now available online. I'll begin by walking you through the roadmap for today. The presentation is broken into 7 sections, which you can see outlined here. We'll begin with a brief introduction to set the context of findings from the engagement, as well as an overview of our scope of work and a discussion about internal controls, compliance, and accountability. We'll also touch on some high-level KCRHA background information just to make sure that we're all starting from the same place. From there,
Mike,
yes.
One moment, quick question.
Sorry, Chair. Mike, could you please, some of us are here in the room, don't have the slides presented on the screen. Could you just make sure that you tell us what slide you're on as you go through your presentation, please?
Yes, so currently we are on slide 2, agenda.
Thank you.
From there, we'll move to the 5 key executive takeaways. And here, I'll specifically point out some of the key issues, especially regarding the $8 million in unreconciled receivables, the administrative overspend, and the interest charges. We'll touch briefly on some of the high-risk areas we identified. We'll walk through the primary drivers of the negative cash issues and the associated risks. And after that, we'll turn to a brief discussion on leadership, staffing, and oversight considerations, followed by a discussion of our base recommendations and consideration for next steps. This presentation is expected to take just over an hour. I will open the floor for questions at the end of the presentation. I do want to note one thing regarding questions and answers. My role here today is to present the facts and the underlying data as presented in the report, as well as any clarifications. My role here is not to provide opinions, speculate, draw management or governance conclusions, or comment on executive decision-making. Furthermore, due to our professional standards and ethics rules as CPAs, I need to limit my questions to members of the governing board only. Okay, moving to slide 4. So what were the objectives of the evaluation? Our work centered on 3 main questions. First, what factors, including financial, operational, and governance issues, contributed to the negative cash balances and limited financial transparency? In other words, what conditions made cash strain worse and made it harder to clearly understand the financial picture? Second, what governance and risk management practices have been in place at KCRHA to protect public funds from potential fraud, waste, and abuse? That question focuses on how the organization is expected to safeguard resources and reduce exposure to misuse or error, and whether those practices were structured clearly enough to support accountability. And third, what opportunities exist to strengthen financial management, increase transparency, and reinforce trust in the organization's ability to carry out its mission responsibly? Together, these 3 questions shape the rest of the presentation by connecting our current conditions, governance expectations, and practical opportunities for improvement in financial management and transparency. Slide 5. I'd like to ground the presentation today in compliance and accountability. It's extremely important, and not just because I'm saying they're important. There are real compliance risks related to the issues we're discussing, and these risks are directly applicable to KCRHA. I'm not going to read everything on the slide word for word, but the main message is that both federal and state laws, as well as uniform guidance, which is the playbook for federal grants management, all have accountability and compliance requirements, including effective internal controls, financial transparency, complete and well-maintained records, and cost allowability. And since KCRHA is a pass-through entity and is administering significant public resources in a highly visible policy area, the organization faces heightened expectations for transparency and accountability. Everything that we're discussing today should be framed within that context. Slide 6. I'm sure that most of you have heard of internal controls before, but I do want to make sure that everybody's clear on what that term means, because it's mentioned quite a bit in this presentation. In simple terms, internal controls are the steps and processes an organization puts in place to protect public dollars, reduce risk, and make sure that spending follows funding requirements. Examples include, but aren't limited to, requiring approvals before spending, or keeping receipts for purchases, and reviewing reports to catch errors or unusual activity. Another term that you may be unfamiliar with is COSO. COSO is an acronym for Committee of Sponsoring Organizations of the Treadway Commission. That committee formed in 1985 to provide official guidance for internal controls, risk management, and fraud deterrence. The COSO internal control framework includes guidance for topics such as ethics, tone at the top, leadership responsibilities, to the need for risk assessments, to the actual controls themselves and whether they're present and functioning, and how information is communicated through an organization. COSO is the gold standard framework for risk management, regulatory compliance, fraud deterrence, and improved operational efficiency. At KCRHA, there is no evidence of a documented internal control framework. And to add to that, our testing found that internal controls themselves aren't operating fully as expected. When that happens, it increases risk for all the things that you see below in the blue boxes. You might recognize some of these as appearing in one way or another over the years at KCRHA. Slide 7. Next, I'm going to briefly go over the financial backdrop at KCRHA. Between 2021 and July 2025, which is the end of our scope period, KCRHA received approximately $533.9 million in funding from several sources, including the City of Seattle, King County, Washington Department of Commerce, HUD, and other local governments, just to name a few. And considering the amount of money going to KCRHA, it obviously raised concerns when the cash balances first became negative in November 2022. The negative cash balances started becoming more consistent each month, starting in December 23, and by July 2025, that balance had reached negative $44.7 million in the King County investment pool. That extended timing matters because it shows that this wasn't a one-time issue, but rather a cascading problem over time. To cover cash shortfalls, KCRHA has relied on both cash advances from the city and by quote unquote borrowing against the King County investment pool by being allowed to go negative in that account. The ongoing negative balance has resulted in accrued and non-recoverable interest charges of $1.26 million as of July 2025. I want to address the $1.26 million in interest expense a bit more. This $1.26 million represents one of three balances I'll be talking about that makes up the $13 million number that you have been probably seeing in the media. The reason that this is so important is that there are no funds to pay this back. This balance continues to grow over time and needs to be resolved with a detailed plan and timeline for how this will be paid back. Lack of controls and weak cash management have resulted in this issue. When we talked to KCRHA staff about root causes related to negative cash, they cite several reasons for the shortfalls. Some of these have included the rapid build-out and legacy issues of accounting infrastructure during the stand-up period of KCRHA. Staff also mentioned the reimbursement funding model as being problematic. They cite slow reimbursements from funders as well as complicated billing requirements, among other issues. The funders have described the issues at KCRHA as being due to lack of transparent or reliable financial reporting, inaccurate and untimely invoice submissions, an inability to provide reliable budget and cash flow forecasting, and a lack of proactive engagement in addressing the issues, even when help has been offered by the funders. My point in laying out these perspectives is to give you some context around how root cause perceptions have been misaligned between KCRHA and the funders, adding to confusion about who should be fixing the issues and where that responsibility resides. To answer that question is complex and multi-layered, but ultimately the responsibility for running KCRHA in an efficient, proactive, and sustainable way lies with KCRHA and not with the funders. Our expectation would be that KCRHA, a standalone entity, should be proactively assessing risk and managing the internal control issues that need to be addressed. Over the course of this next section, we're going to discuss the 5 key executive takeaways from our work. The takeaways describe a connected set of issues and not 5 independent problems. Taken together, these points help explain why cash stress, reporting challenges, and governance risk have been difficult to resolve. As we go through them, the main question is how these issues interact and what they imply for accountability going forward. Moving on to slide 9. First, we'll look at the key barriers to long-term sustainability at KCRHA, which are primarily related to cash issues. The first barrier that you see listed here is the negative $44.7 million cash balance, as we just mentioned. The negative cash balances have resulted from KCRHA being allowed to go negative, essentially borrowing from the King County investment pool, as I just mentioned, and resulting in those interest costs. I'll touch on that again a bit later. The second point are the open receivables of $49.8 million. First, that increasing balance over time represents challenges with converting receivables to cash to keep pace with expenditures. That is a cash management issue. But within that balance, we identified at least $8 million of those receivables to be unreconcilable, risking potential overstatement of past revenues and potential need for an $8 million write-off. I want to take a moment here to talk about the $8 million of unreconciled receivables because of how important the issue is. This is also part of the balance making up the $13 million in unaccounted for funds that you may have read. What I want you to understand is how difficult this will be to reconcile. Our accounting team spent a lot of time on attempting to reconcile the balance. KCRHA also told us that they could not reconcile it as well. The accounting records are such that the details around receivables are not traceable because the supporting information isn't there. The records have been recorded over time through batch journal entries, which means that there's no way to easily trace a specific transaction, how it was applied, and what money was used to pay for it. Understanding and reconciling that balance would potentially require a rebuilding of the accounting records, which would include needing to find all supporting documentation and producing a line-by-line accounting for each transaction that would need to include funder, grant, or award number, fund, and program period at a minimum. It would also need to identify which receivables may be uncollectible or simply can't be identified. This is a process that will require extensive time and research. The primary driver for the negative cash balance and growing receivables is what you see here in the third bullet point. The internal invoicing and reimbursement process has been prone to errors, which has directly resulted in delays. For example, invoicing costs that are applied incorrectly or to a grant that's been closed. When incorrect invoices are submitted, the funders reject those invoices and send them back to KCRHA for correction. And depending on the issue, this can create long delays and invoice rework, as KCRHA often needs to go back to the original contractors for more information, or the programming staff needs to update programmatic budgets. This creates a back and forth effect, resulting in delays where cash collection becomes harder to predict while timelines increase. The reduced visibility makes routine planning extremely difficult. And I will go into a little more detail about the invoice and reimbursement process just a little bit later in the presentation. To complicate matters, KCRHA has managed these delays and unresolved invoicing issues through a cumbersome accounting process that moves questioned or rejected costs into a single holding account to await resolution. This creates an accounting bucket that contains multiple moving transactions and charges in various states of resolution. The difficulty here is that there's no central tracking mechanism to manage the process effectively. And that creates a heavy burden on the accounting function because there's no easy way to account for open issues in real time, where they are in the resolution process, and what that means for timing of reimbursement. Related is that KCRHA has had challenges with providing reliable and timely financial information. There are several reasons for this that will be discussed more deeply in a few minutes, but the cash position issues we're addressing on this slide exacerbate that reporting problem. Because the invoice process and reimbursements are constantly in flux and not tracked consistently, it makes it difficult for KCRHA to manage their budgets and get an accurate understanding of cash position. That matters a lot because leaders, managers, funders, they all need clear and accurate information to identify problems early and respond with confidence. An additional challenge leading to sustainability and cash issues is the history of administrative and programmatic overspend. This points to a broader and related issue around budget management, which will be, as I've said before on other things, addressed just a bit later. So why do all these things matter? Under current conditions and without corrective action, the challenges I'm talking about are likely to continue, including ongoing cash shortfalls and the reliance on advances and borrowing to meet funding requirements. More importantly, there's practical implications here. KCRHA may not be able to fix these issues quickly without additional dedicated staff or outside support. And that points to a potential additional investment of time and cost, as well as potential disruption to program funding processes while corrective work is underway. Slide 10. Internal control gaps increase risk, period. At KCRHA, the gaps in controls are broad enough to raise significant risk around meeting financial and reporting requirements and increases the risk for potential error, fraud, waste, and abuse. In this first bullet, I want to reiterate the fact that KCRHA does not have a documented internal control framework such as COSO. Uniform guidance, which outlines the rules for entities with federal funds, requires a documented and established internal control framework, specifically citing COSO. And when that framework or structure is missing, it creates risk for error and potential malfeasance problems to slip through the cracks. Furthermore, it creates risk for non-compliance with uniform guidance, which could potentially mean loss of federal funding, audit findings, and the need to pay funds already spent back to the federal government. And the concern over internal controls is not theoretical. State Auditor's Office performance and financial statement audits for fiscal years 2023 and 2024 reported internal control deficiencies. Repeat findings for internal control deficiencies should not be a normal thing for an organization such as KCRHA. Furthermore, we also noted that funders communicated written concerns over the controls on multiple occasions, but we did not see documented improvements or a response plan. Our expectation would have been that KCRHA would have urgently initiated a response plan immediately after the SAO audit findings. Our own testing identified multiple cases where expected controls were not followed, and that indicates that these issues still remained active as of July 2025. So you might be asking yourself, did we find fraud at KCRHA? The answer to that remains unclear. In our testing, we did not identify any direct evidence of fraud. However, I underscore that with three things. We used a sampling methodology for testing and did not look at or test 100% of transactions. So something may exist in the financials that we didn't catch. Second, transparency issues in the accounting records between 2021 and late 2024 limited our ability to see transactional level detail, especially around receivables and deferred revenues. Something potentially could exist in those records that would be difficult to identify without a detailed rebuild of those records. And as with any organization with internal control compliance issues, KCRHA has been and remains at risk for potential fraud in the future. All it takes is one bad actor with access and motivation to create a problem. However, there's one key control that does provide some level of comfort around the potential for fraud, waste, and abuse at KCRHA. And that is that KCRHA staff do not have the ability to directly move cash because the cash is controlled through the King County investment pool. Now, that's an incredibly important fact because direct access to cash creates a huge risk for fraud, and the money moving out of that account only happens through the warrant and invoicing process, which is getting some level of review by KCRHA and the funders, and King County is the one that ultimately triggers the cash to be paid. Where I'm more concerned about the possibility for fraud, waste, and abuse are those areas where there's direct or more direct access to cash or cash equivalents. Namely, the P-card program, access to gift cards for the point-in-time program, and potential abuse through employee reimbursements. And we did observe significant non-compliance and controls in these areas. And why does this all matter? As a steward of public funds, KCRHA is required to minimize the risk of fraud, waste, and abuse under Washington state law and federal funding rules, and those requirements are not being met in a meaningful way. And regarding the potential for fraud, I do want to make one thing clear, that the takeaway here is serious but measured. It is true that we found no direct evidence of fraud during our testing, but the current control environment, unless corrected, leaves heightened exposure risk in all areas now and into the future. Slide 11. The third takeaway is about the quality and clarity of accounting records. The importance of quality accounting records cannot be understated. Without it, financial and organizational decision-making becomes based on potentially incomplete or erroneous information. Prior to late 2024, accounting was, as I've said before, primarily batch-level journal entry-based, especially related to invoicing and reimbursements. Now, the reason that that is a problem is that the transactional details, such as the ability to match a payment to an invoice, becomes obscured. So looking at the financials, the records provide a 30,000-foot picture, but there isn't enough detail underneath to easily tell what's happening or what monies funded which transactions. Also, several legacy issues pre-2024 remain in the current records through July 2025, such as certain rolling or unreconciled balances that the staff don't have a clear explanation for. This increases the risk that things like unresolved receivables, for example, might be incorrect or may not ultimately be collectible, depending on the type and requirements of the program. Unreconciled and rolling balances also impact current reporting, which may be incorrectly stated. After late 2024 and up to the end of our scope period, there is still heavy use of manual processes outside the accounting system and cumbersome workarounds needed to manage invoice and reimbursement delays, causing traceability and transparency issues. Transactions are recorded, but they're difficult to trace from end to end. There have been some incremental improvements over time, including the implementation of the NetSuite accounts receivable module in early 2025 and the 2024 implementation of Salesforce, which is their budgeting and program tracking software. However, I want to reinforce that Salesforce, although making some incremental improvements, has not solved the overall reimbursement and tracking problems. In other words, Salesforce, or any other new software for that matter, is not a magic or silver bullet. The problems I'm describing will require a multi-layered organizational effort to address. Next, KCRHA uses NetSuite, which is an acceptable choice for their accounting system. NetSuite is fully capable of customization for reporting needs for an organization as complex as KCRHA. But the accounting team had not invested the time and effort during stand-up or through the period of scope to create the customized reporting required to provide clear and understandable financial picture to stakeholders. This is another factor that leads to these manual Excel workbook reporting, which, as you might know, is prone to human error and potential concealment of information. And finally, KCRHA does not maintain their accounting on a fully GAAP basis during the year. This is not so much a finding as much as it is a comment on effective reporting. Cash basis or hybrid models, such as what KCRHA uses, is easier, but it's also not ideal. GAAP-based accounting provides a much better picture of financial position. It provides accurate reporting of the timing of revenues and expenses, and also reduces the risk of misstatement or misinterpretation. So why does this all matter? To fully understand historical financial activity, especially as it relates to the use of reimbursements and cash advances, would likely require a detailed rebuild of the accounting records. This would potentially be a costly and lengthy process, and is also complicated by the fact that leadership and staff turnover have resulted in a loss of institutional memory. In other words, there may be balances, transactions, and accounting approaches that are unexplainable because the people who made them may not be around anymore. Furthermore, the process could be disruptive because it would have to occur alongside real-time normal operations. Looking forward, the core message here is that the challenge is not whether transactions are recorded, it's whether the records are clear enough, system-driven enough, and reliable enough to support consistent explanation and oversight. Slide 12. Even if the record-keeping issues were somehow instantly improved, the organization would still need consistent financial management routines and processes to maintain accuracy. That's the focus of takeaway 4, that KCRHA needs stronger financial management, budget management, and reporting functions. A foundational requirement for financial management is the maintenance of a full, hard monthly close. A monthly close ensures that all records are correct, supportable, and most importantly, that the organization understands its current financial position. A monthly close should happen on a defined schedule with a standardized reporting package that comes directly from the accounting system. KCRHA has not yet established a consistent, documented full monthly close cycle or a standardized internal reporting package directly from the accounting system. Next, budgets are not monitored in a way that prevents overspending. Just 2 examples, as you can see here, are a $6.4 million programmatic overspend occurring in 2025 that had not been authorized by the City of Seattle. On the administrative spending side, we noted that as of July 30th, 2025, there was a 4.26 overspend or deficit. So I'd like to touch briefly on that administrative overspend of 4.26 million, because that is the other portion of the 13 million unaccounted for funds mentioned in the media. According to KCRHA, overspend was due to budget reclassification and alignment across program types. Although this may be the case, we need to look a little bit deeper. The point here is that KCRHA overspent funds and then made budget modifications after the fact. The takeaway is that there were no controls or oversight in place to manage budgets effectively and prevent overspending. Those figures matter because they don't just point to a reporting issue. It describes a spending and budget control and governance issue. I'd also like to remind you that the fiscal year 2024 SAO financial audit found material misstatements, 37 million and 17 million, caused by improper classification of balances. This is exactly the type of problem that a consistent monthly close is meant to catch. Furthermore, the audit stated that the balances were expected to be corrected. However, when we looked at the current fiscal year 2024 internal financial statements, they showed a $1.3 million difference from the issued audited financial statements. The fact that they don't match the audit is concerning and needs to be corrected prior to the 2025 audit. More important is that the discrepancy has had additional impact on the accuracy of the current financial statements. Finally, several policies and procedures were created in 2021 to support accurate reporting but they haven't been updated and need to be reviewed and updated to reflect the structural, financial, and organizational risk factors that have evolved over time. Policies are only effective if they match the organization's current environment, which is completely different and much more complex than KCRHA's operational environment during the stand-up in 2021. So why does this matter? Inconsistencies in financial management, budgeting, and financial reporting should be managed through a strong close process. Otherwise, problems like the ones described undermine confidence among stakeholders. The main point is that consistency and stable processes in financial management are what allow leadership and funders to catch issues early, understand them clearly, and respond before they become larger financial or governance problems. Slide 13. So the natural question is, what would it take to stabilize the organization from here? The fifth takeaway is that stabilization would require a multi-layered approach and would possibly mean a significant investment in time and financial resources. This would be especially true if the internal capacity was limited and the work needed to be performed by outside consultants. I'll lay that all out in the final section of the report, but the takeaway is that the current and legacy issues will require coordinated work across cash management, invoicing, accounting records, reporting, budgeting, leadership, and risk management. Here you can see a list of the highest priorities that should be addressed. First, KCRHA needs to stabilize and address the growing negative cash position. And I want to provide an example to you as to why these priorities will take such a multi-layered and complex initiative. For example, some of the things that KCRHA will need to do to solve the negative cash issue, and this is just from a high level, will be to perform a process audit of the invoice and reimbursement process to identify the root causes of invoice errors and delays. Put proper systems, workflows, and controls in place to mitigate the risk and control the process moving forward, noting that internal controls should be based on a formal risk assessment that's examined the organization's financial, compliance, and reporting risks to meet KCRHA's objectives. Next, they'll need to develop a complete and documented picture of open receivables and their status through time, whether they are in progress, whether they're even collectible. Basically, a full reconciliation of every outstanding item, and noting that this may require some or total historical rebuild of accounting records to get to a complete picture. Next, KCRHA will need to complete and document an understanding of the status of advanced funds, a detailed accounting of how those funds were used and what cash remains available, if any. KCRHA will need to create a plan and work with funders in the prescribed format to possibly request additional funding, but it needs to be grounded in reliable financial and budget information and tracked through consistent reporting. And finally, KCRHA needs to address and resolve the $1.26 million interest expense and how that's going to be repaid. Moving on, KCRHA needs to establish accurate, complete, and reliable reporting that comes directly from the accounting system. That will decrease the risk for errors while also lessening the sheer amount of work required to manually piece together certain financial reports. Next, KCRHA needs to strengthen budget management and address overspend issues, since this increases pressure on an already strained cash environment. And finally, KCRHA needs to perform a risk assessment and align with COSO internal control framework to maintain compliance and decrease risk. And why does this matter? Addressing the issues could help to ensure KCRHA's long-term stability and effectiveness. But as I've mentioned, it would likely require a significant amount of time and cost commitment and could potentially pose risk for service disruption, since this would be occurring simultaneously with everyday operations. The final takeaway is that stabilization needs to be viewed by stakeholders as a major organization-wide change management process that will touch multiple areas at KCRHA. It will not be resolved by a quick correction, simple accounting fix, or a new software. Meaningful correction would require sustained management attention, a clear order of priorities, and steady follow-through over time. Slide 14. We're going to shift away from the executive summary into some more specifics around the higher risk areas. This will touch again briefly on internal controls, but also provide some detail in those areas where staff do have direct access to cash or cash equivalents. Slide 15. One of the high-risk areas we identified is around employee reimbursements. In our testing, we noted 2 items that appeared unusual compared with typical reimbursement activity, although we weren't able to determine whether those were actually allowed under the contract. The first is that an interim CFO was reimbursed for lodging, meals, and incidentals between September and November 2024. The total paid for that was just over $9,000 and occurred for 28 specific days. We also noted that a chief program officer was reimbursed just over $13,000 for relocation costs, made up of $12,500 for moving costs and $940 for vehicle transport. In general, we found that several sampled reimbursements, including the items that I just mentioned, did not have consistent approval and/or supporting documentation. And why does this matter? It matters because we were unable to verify proper approval and allowability for these reimbursements. I should also mention that the relocation reimbursement was not included in the proposed budget for that year. Ultimately, the reimbursement was paid to the staff almost 3 years later. Slide 16. Another high-risk area is gift card management. Gift cards require strong controls because they function much like cash. In our testing, we identified 9 bulk purchases of MasterCard gift cards totaling about $36.7 thousand. And those purchases were determined to be primarily part of the point-in-time program. The risk here is that gift cards could potentially be pocketed by staff or volunteers, and so the need for very tight tracking is critical. Basically the same level of tracking that's required for inventory, for example. Some tracking does exist, but for the sampled transactions, records showing the final recipient were not available. As a result, based on the information provided, we could not follow a fully documented trail from the original purchase to distribution to staff and then to the final beneficiary. That does not mean that the cards were necessarily misused. It does mean that the documentation provided was not strong enough to fully support the activity from beginning to end. More work would be needed to reconcile all gift card activities. Slide 17. Now we'll turn to accounting system permissions. Accounting permissions define what access each user has in the system. For example, the controller might have full permissions, while a junior accountant might only have read-only access. A basic control principle is that one person should not control every step of the same transaction. It's called segregation of duties. Now, I know there's lots of words on this slide. The overall point is to say that current permissions around key accounting functions, such as invoicing, period posting override, and journal entry creation and approval, are not set up in a way to support segregation of duties. And this significantly weakens internal controls and increases overall risk. For example, the chief admin officer currently has full rights to make or change transactions across accounts payable, posting period control, and journal entry creation. That might be reasonable given that person's job duties, but I do question the AP clerk having access to post entries across periods. Only the controller should have that access, and only after getting documented authorization for making that change. Again, this is a conclusion about risk, not that misuse necessarily occurred, but it is a meaningful control weakness. Slide 18. P cards are another area where strong controls matter because they, like gift cards, provide immediate access to cash. Through July 2025, total P card expenditures was $1.1 million. P cards are typically meant for small incidental purchases. And this is why, like in the other areas we've discussed, policies, procedures, and controls are critical. We did note that the KCRHA P card policy is still in draft form from 2021 and needs to be finalized. In addition, a written accountable plan, which is required by the IRS for P card programs, was not provided to us. Testing showed non-compliance issues in 100% of samples reviewed. Those issues included no required purchase acquisition form for prior approval, purchases made by someone other than the cardholder, missing receipts, and unexpected approvers. Now, why is this important? Because when pre-approval cardholder use, receipts, and review are not consistently enforced, inappropriate activity can be harder to detect. This is an area where tighter controls and more consistent follow-through are needed. Slide 19. This is the final slide in the high-risk section of the presentation and takes a specific look at hotel-related P card purchases, including about $223,143 at Inn at Lake Washington and about $136,394 at SeaTac Crest Motor Inn, along with a couple of other motels you can see on the list. These were large programmatic expenses tied to emergency housing during the Lived Experience Coalition wind down, where the use of P cards bypassed the normal reimbursement process. Based on the information available to us, it appears that the specific situation may have warranted P card usage because of the fast need for cash to get homeless people housed immediately. However, the concern is that these purchases didn't happen all at once. There were multiple instances of payments over time to these motels, meaning that there may have been time to put a system in place to avoid P card usage. After the initial response, a better process might have been to contract directly with the motels so that tracking, approval, invoicing, and reimbursement could follow a more standard and approved path. Two gaps in controls are especially important here. No purchase acquisition form was provided, and no documented CEO approval was provided where the approval threshold dollar-wise required it. So the issue is not simply that large purchases occurred. The issue is that these purchases continued without normal documentation and approval structure. Slide 20. I know an important question in everybody's mind is how could an organization receiving such a substantial amount of funding still face serious cash pressure? This next section dives a little deeper into the operating conditions that continue to drive that cash balance down. Slide 21. This slide offers the most fundamental explanation to the negative cash position. The invoicing and reimbursement process are inefficient. I've touched on this briefly before, but here we're going to take a bit more of a deep dive since this piece is so critical. KCRHA regularly submits invoices with inaccurate program coding and budget information. When costs aren't coded correctly or tied cleanly to the right program or budget, the invoice needs to be corrected before it can move forward. When the funders receive invoices with problems, it results in invoice rejection. The invoice is sent back to KCRHA, who then needs to research, rework, and resubmit. This often takes a lot of time and results in delays. And furthermore, KCRHA needs to hold weekly meetings with funders to try and work through all the various issues. Also, KCRHA relies on statements from the county, which are provided weeks after month end, to fully reconcile and gain visibility into what has or has not been paid. The timing problem becomes even more difficult because visibility into funder approvals, payment timing, and reimbursements are not tracked in a meaningful way. So leadership doesn't easily have a real-time picture of what invoices have been accepted, what is still pending, and what may need to correction, and what the ultimate effect on cash timing looks like. The process involves many moving pieces, so the need for central and documented tracking is critical. Furthermore, fund swap issues, complicated by weak communication channels, have also created significant delays because the rework process for fund swaps is multi-layered and multi-system time-intensive process. On a brighter note, we have heard reports from KCRHA that the implementation of Salesforce has made incremental improvements to this process. Specifically, and recently, staff reported the use of unique identification numbers, which they say has made it easier to match rejected items within the accounting system. This has all occurred recently and outside the timeline scope of our engagement, but staff did say that King County would be required to use these unique IDs in their processes so that costs could be better matched. However, this places additional administrative burden on the funders who have their own internal processes to help KCRHA manage their own receivables. The main takeaway is that slow reimbursement process should not be explained away as simply a funder problem. Next, I want to take a minute to address why the reimbursement funding model should not be seen as a primary driver in the negative cash balance issue. There are many similar sized organizations that successfully manage a cost reimbursement funding model. In other words, a reimbursement model is not unusual. There are many large nonprofit and public sector organizations that operate successfully under this exact structure. It's true that the model assumes that an organization will pay providers first and then be reimbursed, but it also assumes strong discipline by management around cash management, billing, and spending decisions. When this model is working well, small negative cash balances can happen, but they're expected to be temporary, planned, and closely monitored. Leadership should know how much cash is going out, how much is billable, when invoices are being submitted, and when cash is realistically expected to come back in. What we observed at KCRHA is something different. The negative cash balance didn't remain small or short-term. It grew steadily over time, reaching a level that indicates that the organization was paying out significantly faster than it was converting receivables into cash. And that doesn't happen solely because of the funding model. It happens when costs move faster than invoices, when invoices are delayed or returned for correction, when spending continues without regard to reimbursement timing, and when cash trends are not escalated early enough for leadership to intervene. In other words, the reimbursement model creates pressure, but the size and persistence of cash deficit at KCRHA reflects how that pressure was managed internally. Slide 22. A second source of cash pressure is the management of the administrative budget itself. As of July 2025, KCRHA carried an administrative cash deficit of about $4.26 million. That deficit included the $1.26 million of interest accrued, and that interest expense continues to grow. The next point is important. Advanced funds have not been reconciled or tracked consistently against spending in a way that gives visibility into how those funds were used or what balances remain. This is a budget and financial management critical issue. There's also a process issue that contributes to the cash problem. KCRHA has not consistently followed the administrative steps required under the master service agreement with the city and the county for requesting advanced funds, including following the formal request process and the submission of complete and transparent cash flow forecasts and budgets. When the request process is inconsistent and the reporting is incomplete, it becomes a barrier to providing that cash. One example of the administrative overspend was the implementation of Salesforce. Salesforce implementation occurred in 2024. It was not approved or mentioned in the 2024 proposed budget. It was later approved as part of a budget amendment at a cap of $563,000, but the total cost ended up an estimated range of $2 to $3 million. This slide points to overspending, limited tracking, and weak visibility happening at the same time. That is why stronger controls, planning, and oversight are needed to manage these issues. Slide 23. Another contributor to administrative cash pressure has been the reliance on hiring long-term temporary contract staff in key leadership and other roles. KCRHA spent $2.96 million for Robert Half staffing through July 2025. Contractors are expensive, and there's obviously a premium when hiring through a temp agency. In our experience, we see that temporary staff is typically used for short-term transitional solutions. As an example, we compared the Robert Half payments for the interim CFO, who was contracted through Robert Half, between November 2023 and December 2024, so 11 months, and compared that to the direct hire benchmark cost for that same person and position who was hired as an employee, the CFO or interim CFO at the end of the contract. Here you can see that Robert Half was paid $448,497 for the entirety of the CFO contract. That person was then hired at a salary of $285,000. For comparison purposes, if we take that 11-month salary at $285,000 and apply it to the 11-month period, you get $261,250, and a decrease of $187,000 or a 72% premium over direct hire. I should note that we can't comment on whether the extensive use of Robert Half was appropriate or not. However, we did ask for any sort of documentation that outlined the strategic decision-making for that expense, and we're not provided with anything. Now, what ultimately matters here is that this is not just a staffing decision, it's also a budget, governance, and cash decision. When higher cost temporary support continues without a clearly documented rationale, administrative spending can rise quickly, and leadership has less support for explaining why the higher cost was necessary. In an environment that is already under cash pressure, that premium becomes more consequential and harder to absorb. Slide 24. The last item in this section is indirect cost rate, which is a calculation used to allocate administrative, so non-program related costs, and where compliance is critical, especially in federal grants management. This topic is a little bit technical, so I'm not going to spend too much time on it, but the reason it's important is not just because of the compliance risk. An indirect cost rate sets the rate at which you can recover administrative costs. And that can vary from high to low, from low to high or high to low. In other words, it can potentially increase the amount of funds available for your administrative spend. That's why this is a cash issue as well as a compliance issue. What I want you to take away from this slide is that there's a good possibility that KCRHA is quote unquote leaving potential funds on the table because they're using what's called the de minimis rate, which is basically a default percentage defined through uniform guidance and is the lowest rate. There has not been an effort to obtain a negotiated cost rate, which could significantly increase the amount of cash available to cover administrative funds. We sampled a document showing an invoiced indirect cost rate de minimis cost calculation. The indirect cost rate analysis was outside of our scope, but in a limited review, our grants team was unable to confidently determine the appropriateness of the calculation through the workbook provided to us. The second thing to take away from this slide is that there is an opportunity here to strengthen and reinforce the institutional and finance team knowledge base around indirect cost rates and the broader uniform guidance requirements. This is critical for any organization managing federal funds. Third point is that we strongly recommend that KCRHA undergo a formal uniform guidance readiness assessment and indirect cost rate analysis to both verify that current calculations are working correctly and to evaluate whether a negotiated cost rate, which would be a second step in the process, would ensure the best outcome for indirect cost recovery. All of this matters because the potential for inappropriate or incorrect indirect cost rate cost allocation, including not having correct cost pools, raises the risk for compliance findings under uniform guidance and loss of potential cash coverage. Before moving into our recommendations, this section is important because the issues in this review are not just about invoices, cash, and accounting entries. They also relate to leadership coverage, finance staffing, and oversight. In other words, if the people, reporting lines, and review structure aren't clear, the same problems can continue even after individual items are fixed. Slide 26. Early in the engagement, starting in August 2025, there was an almost 4-month delay in getting started. One piece of the delay was KCRHA requiring us to sign a data sharing agreement. This had to go through several rounds of contract language review and stalled our ability to begin work. Second, it took almost 4 months for KCRHA to start responding to our requests for information. Communication was also slow and difficult in responding to questions and clarifications. The information, when it was provided, was sometimes incomplete or did not match what we had requested. The flow of information did improve in 2026. However, the delay resulted in having to amend the timeline and the contract and also increase the engagement budget by over $150,000 from the original estimate because of the problems we were encountering. Next, I wanted to point out that the CEO was not present at most of our biweekly KCRHA executive leadership updates. For a meeting whose purpose was solely to inform executive leadership on issues in progress, it surprised us from an ownership, oversight, and urgency perspective that she did not participate in these meetings. From a staffing perspective, we noted a significant leadership coverage issue. The organization chart shows no dedicated CFO position. That matters because the CFO role is who we would expect as the primary oversight point for several of the issues discussed in this report, including the negative cash balance position, reimbursement delays, budget management, and others. Overall, it is difficult to understand who, if anyone, is performing this function. Additionally, given the size and complexity of finance operations, KCRHA should consider building out the accounting team to include those with experience in federal grants and who can potentially cross over with programs. Next, KCRHA should consider forming a finance committee that provides oversight over a corrective action plan, public funds accountability, and an escalation pathway that funders can use to communicate concerns. Slide 27. Providing narrow standalone recommendations is challenging because the issues facing KCRHA are interconnected and reinforcing, not isolated. Each step is going to depend on the others and will require time, sequencing, and sustained capacity. I believe that Mayor Wilson has a question.
Mayor Wilson?
Yes, thank you. And my apologies for interrupting the presentation. I'm actually at the airport and I'm needing to board a plane in about 10 minutes for a prearranged work trip. But obviously I wanted to be present for this critical discussion. And so just wanted to say one word before I drop off in about 10 minutes. So, I mean, I think what we're hearing here is deeply alarming, and I think we all share urgency to ensure that we're appropriately safeguarding public funds. I believe that we need to take action that is decisive, but also thoughtful. And I just want to recognize the public comments that we heard around ensuring continuity and stability in service delivery, both for the vulnerable communities that we serve and also for our workforce. My Deputy Mayor, Brian Surratt, will be joining for the rest of the meeting as my proxy to represent Seattle's perspective, and also when we get to the Finance Committee resolution to offer some amendments. So keeping it short because I don't want to interrupt too much, but just wanted to say a couple words before I leave.
Thank you.
Thank you, Mayor Wilson. Okay, moving on to slide 28. So for this presentation, we've organized our recommendations into 5 broad categories with a deliberate focus on the highest priority items. These categories are not independent work streams. They build on one another and progress in later areas, depends on progress in the early ones. First are the foundational recommendations. This is the highest priority category because it underpins everything else we're recommending, including addressing the ongoing cash shortfalls. At a fundamental level, KCRHA needs to reach a point where its accounting system and underlying financial information can reliably support decision-making. That means producing information that is timely, consistent, accurate, and dependable enough for leadership, funders, and oversight bodies to rely on. Practically, this includes fully establishing financial reporting capabilities through NetSuite, addressing legacy accounting issues that continue to distort current period reporting, and implementing a disciplined recurring month-end close process. Without this foundation in place, it becomes very difficult to manage cash, budgets, or compliance in a sustainable way. Next, once the foundation is in progress, the next priority is stabilizing the invoice and reimbursement process, which is a primary driver of cash stress, as I've mentioned. This means identifying and correcting the root cause of invoicing errors, putting consistent procedures and controls in place, implementing a layered review, and providing targeted training where needed. It also means building reliable tracking so that invoices that enter a resolution process don't lose visibility or momentum. In parallel to that, the budget management process needs stronger oversight and more proactive monitoring. Budgets need to be actively managed and standardized so that spending is controlled in real time rather than reviewed after issues have already occurred. Third are the structural and compliance recommendations. This includes assessing KCRHA's readiness under uniform guidance and evaluating cost recovery options. Specifically, whether pursuing a negotiated indirect cost rate would better support required administrative activities. It also includes formally documenting and standardizing administrative cost allocation methodologies across both federal and non-federal funding, and establishing clear, defensible procedures to meet all interlocal and master service agreement requirements consistently. Slide 29. The fourth category focuses on the control environment and risk management. Key steps would include performing a COSO risk-based assessment and implementing an internal control framework, establishing a formal risk management program with clear ownership and escalation pathways, and aligning practices with uniform guidance requirements across funding sources. Policies and procedures also need to be reviewed and updated so that they reflect the current organizational structure and evolving risk profile. And finally, we have the cash and sustainability recommendations. For KCRHA, first, KCRHA needs a single source of truth for cash, essentially reconstructing cash activity so that it's clear what funds are available through advances, internal borrowing, and reimbursements. Accounts receivable also needs to be triaged and segmented so that leadership has a real-time understanding of what's collectible, what's delayed, and what represents legacy risk. In the near term, basic cash controls need to be implemented, such as routine cash sufficiency reviews tied to payroll, contractual obligations, and reimbursement timing. Spending also needs to be aligned with reimbursement reality, not just budget assumptions. Importantly, there needs to be clear ownership assigned for cash and liquidity risk, someone accountable for overseeing the cash sufficiency, receivable resolution, and advance reconciliation. And KCRHA needs to move away from crisis financing and towards structural correction supported by a formal coordinated action plan. Okay, slide 30. And I believe this is the last slide before the end of the presentation. I know that everyone's going into executive session, so I will go over this quickly. Successful remediation will likely require a significant amount of time, financial resources, and organizational focus. Meaningful improvement will also require carefully managed project sequence while simultaneously maintaining adequate operational capacity for day-to-day operations. Now, where internal resources are insufficient, the use of external accounting, advisory, and project management support should be considered. I'm not going to read through these, but this is a list of the types of service that we would recommend to address the issues at KCRHA. Now, again, if performed entirely by external professionals, those services would likely result in significant costs and extended time requirements. While historical factors and root causes may vary, current management should focus on operating an effective and sustainable organization with appropriate stewardship over public funds. Proactively addressing the conditions described in this report is important to achieving those objectives. And that concludes this presentation. Again, I want to thank KCRHA Governing Board for inviting me to be here today, as well as everybody else on this call.
Thank you very much for that presentation, Mike. I want to take a moment to just summarize the things that I heard. These findings make clear that we're dealing with systemic challenges, not a single breakdown, but a set of compounding issues over time. These include major gaps in financial management, delays and breakdowns in invoicing and cash flow, weaknesses in internal controls, and a lack of consistent, reliable financial reporting. Together, these issues create very serious risks to transparency, accountability, and the effective stewardship of public dollars. At the same time, it's important to be clear about what this report does and does not say. It does not point to evidence of fraud, but it does make clear that the systems this agency relies on to safeguard public funds have been very weak. That is absolutely unacceptable, and that must be fixed immediately. Mayor Wilson and I, as new board co-chairs, have already laid out expectations as funders in a joint letter: immediate corrective actions, stronger financial controls, clearer accountability, and a detailed plan to stabilize the organization and adopt the recommendations that we just saw in the report from Clark Newport. That work needs to move forward with urgency and discipline. And I also want to say this before we move into questions. KCRHA is not an abstract system. It is made up of people and service providers, professionals who have chosen to do some of the hardest work in our region because they care deeply about this community and about helping people who are experiencing homelessness. Many of the people in this organization and those who are contracted to do the services inherited a flawed system with many of these challenges, and they are working hard to make it better. That context matters. It does not change our responsibility to ask tough questions and demand change. It does not change our responsibility to hold the system accountable. I intend to do that, and we have already begun to do that through the letter that the mayor and I sent. But we can do that while also recognizing the people doing this work and the importance of getting this right for them, for taxpayers, and most importantly, for the people that we serve. None of us can afford a disruption to the services that our unhoused community rely on to stay safe and alive. Yes, we have to move with urgency, and yes, we also have to move thoughtfully and methodically. There is too much at stake. With that, I'll open it up to questions only from the governing board, as was requested by Clark Newbert. Any questions, Councilmember Barone?
Thank you, Chair. Mike, thank you for the presentation and for all the work that you've done to identify the issues that you've outlined, even though the news is, of course, very sobering and troubling. I wanted to ask you, along the lines of what the chair mentioned in terms of the timing of some of these issues. I wanted to focus on the $8 million in open receivables that are unreconcilable, as well as the overspend. I realize this might be difficult because part of the challenge is the documentation, but I'm curious if you have a sense of the timing of those issues, whether those happened, in what I would describe a period of challenges internally for KCRHA, or are they spread out during the period? I know you were looking at like multiple years, Do you have any sense of whether all of those happen during a specific period, or are they spread out over the period that you identified?
Yes, the answer is that they're spread out over the entire period.
Okay, thank you.
Mike, I'll ask a question. You know, you mentioned many weak financial controls. You mentioned no documented internal control framework, no standard monthly close, no segregation of duties. Could you just add some qualitative color commentary on this? To give us some perspective, how unusual is this for an organization of this size?
So the objective is to provide stewardship over public dollars. Large nonprofit and governmental organizations that I have seen in the past typically do pretty well in terms of having internal controls and processes. I think that any organization like this struggles with these types of issues, but you know, the issues that we're seeing here are significant.
Board members.
Well, thank you so much for the presentation, Mike. Again, I appreciate it, and it's difficult news to receive, but I appreciate the level of detail that you provided. I wanted to turn to some of the charges that you mentioned when you were talking about some of the ongoing costs related to using P cards for hotel rooms. I believe you used the phrasing, I think you said it occurred over a period of time. Can you share more about that? Are we talking about several months during the close down of that program, or are we talking about over a year?
Yeah, I don't have the exact timeline, but the point to take away was that, you know, it may be okay to make that kind of a charge using a P card, but then a process needs to be put in place to not let that happen again. And instead, there was another P card charge, and then there was another P card charge for those big amounts. And those were done, you know, we looked at the backup and there was an approval related to those.
Thank you. Chair, if I may.
Yes, please.
So another component that you talked about was the reimbursement rate and the need for the agency to go back and sort of renegotiate that rate. Were you able to identify what is driving the current rate?
So this is a bit confusing, actually. If you go through the financial records, there is certain documentation that shows all sorts of different types of rates. Some show, oh, we're just taking an 11% rate. Some say, oh, we're spreading it over the course of the grant. It's all very difficult to track as one continuous system.
Board member.
Thank you. Thank you, Mike, for this detailed presentation. These are serious findings that warrant immediate action to remedy. And I want to take us to slide 26. There's a bullet point here under the subheader related to staffing, where you point out considering building out the accounting team to include those with expertise in federal grants. It sounds like there was some type of evaluation you all may have done related to staff qualifications and expertise. I'm wondering, can you clarify, was that a part of the evaluation?
No, it was not, except that we noted in our work that they're overwhelmed with work and do not necessarily have depth of knowledge in uniform guidance rules, which is extremely important. We also noted that there's some siloing between programs and accounting, where we would expect there to be some crossover there, because the two aren't mutually exclusive.
Board member Fain.
Thank you. I just wanted to follow up on your answer to Member Barone's question around timing. Is there any evidence, or can you really tell if there were trends in the nature or kind of the severity of the issues over time? I'm trying to establish whether there's any periods where challenges like overspending or reporting inconsistencies were more acute,
Yeah.
or was it just consistent over the years?
Yeah, so the reason why we looked at those in particular is because they were such high charges. We did data analytics over the rest of the charges, and there wasn't really any consistent pattern. The issues that we found were, for example, there were thousands of dollars in Amazon charges, which might be correct, might be allowable. We looked at a few of those, and some of them contained furniture and clothes, fairly small amounts, compared to the amount of money that we're talking about. But they may have been allowed via the grant contract.
Mike, could you speak a little bit more about the negative cash balance of $44 million? Of course, this is especially concerning for us here at King County since we are the treasurers, and we want to understand that as much as possible. How much of that negative cash balance has to do with just how much of it is just inherent to the structure of this quasi-independent organization that has to borrow money and that has to wait for resources to come to it versus something more to do with actions on the part of the organization itself?
So good question. So this kind of goes back to the discussion that I had on the reimbursement model. If you look at like a trend of cash coming in and receivables, it should look like two sine waves, basically. You grow, you do your expenses, grow your receivables, you get the cash, it comes back down. And that's a repeating pattern. And it is difficult to manage, but it is successfully managed by many organizations. Sometimes there's some negative cash balance involved there, but it's super temporary. What we're seeing, and if you refer to the report, I don't know what page it's on, but it's a big graph towards the beginning of the report. You can see that the receivables continue to grow, and the cash continue to decline. So not what we would expect to see. And so what needs to happen is better management internally around budgets, managing the cash flows, understanding, what's been paid, what needs to be paid, and the timing around that.
Thank you. Yes, board member.
On slide 5, and again, thank you for this comprehensive presentation. On slide 5, you talk about the federal law that requires the comprehensive accountability requirements. And so can you tell me, when the organization started, was there any sort of proof that we had to show that we had these, that we had met requirements? And is there any auditing that happened? And if so, did you have any information on how that went and how this oversight continued?
Yeah, unfortunately, that was outside of our scope to look at specifically at federal grants. But the problem really is that lack of internal controls. I don't know if they've had a federal audit before, but that is something that should be looked at.
A question regarding the Salesforce implementation. It shows on here $563,000 as part of an amendment was budgeted after the fact, but it ended up costing between $2 and $3 million between implementation, consulting, and then a project manager salary. Can you give us a little more information around how long this process, how long this money was accruing specifically for this implementation?
Yeah, I don't have I would have to check my records right now, but it's probably over the course of a year or more that it occurred.
Okay, thank you.
Mike, can we go back? Just for the sake of the public, could you take some time to explain exactly what that means in as accessible terminology as possible? I know some people have used the term missing, some people have said unreconcilable, some people have said not accounted for. What does that mean in plain language, and within reason or your best judgment, what is the best case scenario for that and what is the worst case scenario for that?
So yeah, I've seen multiple words being thrown around, but what it really relates to is basically a lack of accounting records to support the financials. Whether it's lost in terms of the $8 million receivable, turns out it's not accurate and it needs to be written off, that would be lost funds. But, you know, I don't think missing is quite the right term.
Thank you.
It's just not accounted for clearly enough.
Okay. Thank you. Board Member Backus.
Thank you, Chair. Mike, thank you. This is very thorough. Wondering on the P cards, and I know on slide 18, you talked about a P card policy still in draft form from 2021. But were you able to, in that policy, does it say who, what departments, anything about who should and who should not have P cards?
No, and it also didn't describe what what approved purchases are and things like that. It literally was just a couple paragraphs in draft.
Okay, and so did you find that a majority of the employees had P cards, or they were just being used, the same P card being used by multiple people, or that you wouldn't be able to tell as much, I realize?
Yeah, so if I remember correctly, as of July 2025, I think there were 9 people with P cards. Okay. But in our testing, we found card usage from people other than what we expected. And we found a generic card, like a KCRHA card, rather than assigned to a person. And we don't know what that was for.
Okay, thank you.
Board Member Jay.
So on the last slide, recommendations and next steps, you know, there's a list of 10 things that would need to be done. With this potential large time and cost investment, do you have a rough estimate of what level of magnitude we're talking about here?
I'm sorry, are you talking about the time or cost?
Both.
Yeah, so I don't want to speculate, but I am a professional and I know what our rates are like. So, you know, it could be potentially in the millions of dollars if all of this was performed by consultants. But again, that is speculation. And timing, the reason why timing is going to take a long time is because of the fact that all of these issues are so intertwined, as I've said through the report. So one issue is being caused by another issue, and a third issue needs to be corrected before those other 2 issues can be corrected. So, you know, it may take a year or more.
Thank you.
Any final questions from the board? Anyone online? Going once?
I have a final question.
Yes, board member.
This is very complicated, so I'm going to ask the question and hope it will make sense. With this $8 million that's unreconcilable, does this mean that the total amount of money that has been talked about could change that total amount for some reason if it could be found, because unreconcilable means that there isn't really a record of how we received it, correct?
Correct. So what it means is that it was recorded in the books or something got paid and invoiced, but there's no way to match any invoices to that. So we don't know if they got paid for it or not. And so it's going to be kind of a Sudoku kind of process to try and go through and figure out that line of what happened. Does that answer your question?
Yes, thank you.
Board Member Foster.
Thank you, Chair. I'm gonna go in a different direction quickly. I know you mentioned the state auditor's report. I believe you said that was in 2022 and 2023, that there were 2 consecutive years of findings in those reports. Was there corrective action taken following those reports?
So I think it was 23 and 24. I could be wrong because I don't have my slide deck quite there. We did not see any evidence of corrective action. I would have expected a corrective action plan and a timeline and how they were going to address those issues.
Any further questions?
I have another question.
Yes, please.
Was there an audit in 2025?
The 2020, so there was an audit in 2025, but it was for 2024 financials. The 2025 audit has not started yet.
Okay, thank you.
Yes, Board Member Foster.
Thank you so much. I'm working on pulling up the slide that I'm referencing. Okay, well, Mike, I'm sorry, I was trying to give you a slide, but I can't give it to you. But in the presentation, you talked about a significant increase. Actually, you talked about a sort of a lean and a trend towards negative cash balances around 2023. Was there any kind of marker or indicator of why 2023 was significant? Like what happened in 2023?
Yeah, so and we looked at the cash over time to try and see, was this consistent or was there like things that happened that would have caused a massive cash outlay? And there were some things like the Salesforce implementation, but we did not see, it was basically just consistent through the period. We didn't see any major impacts from a single event, if that's what you're asking.
Thank you, Mike. Thank you, Chair.
Thank you all. Seeing no further questions, we're going to move on to the next agenda item. Thank you very much for that presentation, Mike. It was very illuminating. There's a lot of work to be done to fix these problems, protect taxpayer dollars, and make sure we're addressing the homelessness crisis with the urgency and accountability it demands. I think the full board is in agreement that we need to adopt these recommendations with urgency. And I think part of that work is connected to the next agenda item, where the board will consider a resolution to establish a finance committee. I want to turn it over to my colleague, Board Member Barone, if you would like to speak to the need for this and what your vision is in the proposal.
Thank you, Chair. I know we have discussed this item previously, but I want to remind the board that this is an issue that we've been discussing with your offices over the last few months prior to the results of this evaluation. But obviously now, I think the need for this type of structure is clearer than ever. And obviously, it's one of the recommendations that has been put forth by Clark Nuber. The concept has been to ensure that the board has a mechanism to be able to carry out its oversight duties with respect to finance. So that is why I'm bringing it forward for your consideration and urge your support. And I'm happy to move it if that's helpful, Chair.
Thank you. Yes, please do move resolution 2026-04.
I move that we approve resolution 2026-04.
Is there a second?
Second.
Thank you. The motion has been moved and seconded. Any,
Apologies. It seems that Deputy Surratt has raised his hand.
okay, Deputy Mayor, please go ahead.
Good afternoon, everyone. As Mayor Wilson noted, I'm serving in as her proxy. And I want to thank all the board members here for introducing this resolution, in particular Board Member Barone, for your consistent leadership for the establishment of this committee, this Finance Committee. Mayor Wilson would like to propose some amendments. We had originally planned to bring forward these amendments as a separate resolution, which was shared with all of you at the end of the day yesterday. However, because this is a special meeting, we cannot take action on walk-on items. These amendments align with the purpose and the intent of the Finance Committee. I want to thank Member Barone for his support of this approach. The intention of these amendments is to be responsive to the findings of the forensic evaluation and incorporate specific actions that were outlined by Mayor Wilson and Executive Zalai that was included in the cover letter transmitted to CEO Kennison on 4/22. These proposed amendments specify additional clear direction to the Finance Committee to ensure proper financial oversight during this period. The intent is to specify safeguards related to the administration of public dollars in alignment with our role as governing board members. As mentioned in the letter, these actions are intended to support management. The intent is not to create undue impact or to harm management's ability to carry out the essential duties held by the authority, such as execution of contracts and processing of invoices within the established budget authority. Chair Zalai, I would like to move to amend Resolution 2026-04. This amendment adds 4 recitals and amend Section 1 of the base resolution, adding items E through H. For ease, so I think we can see what's under consideration. Thank you for displaying that on the screen. Here are the 4 recitals and the 4 items.
Deputy Mayor, may you read your edits? I think there are some people who don't have the presentation in front of them.
Great, we'll do. So the 4 recitals that we request to be added, whereas the City of Seattle and King County each hold master service agreements with the authority, requiring it to safeguard allocated funds, establish a system of financial controls, and ensure funds are used in accordance with the terms of the agreements. And whereas a forensic investigation completed in April 2026 found significant failures in the authority's internal controls and financial stewardship to the extent requiring immediate and comprehensive corrective action. And whereas the investigation identified unreconcilable and unrecoverable cash, including the growing interest of $1.26 million, $8 million that cannot be matched against KCRHA financial records, and $4.26 million in administrative overspend. Whereas KCRH holds a negative $62,800,000, you can read, balance in the King County investment pool as March 2026. The sections that we'd also like to be included in the amended resolution. E, approve any new agreements that increase our costs or liability where there is not existing budget authority granted. Notwithstanding this provision, the CEO may execute continuum of care grant agreements as approved by the Finance Committee. F, develop and approve a documented exception process for the hiring of positions critical for core service delivery. The CEO shall pause on the recruitment and hiring of vacant or new positions unless approved by the Finance Committee. G, define discretionary spending. The CEO shall pause on any discretionary spending unless approved by the Finance Committee. H, the amended language to this, undertake the activities that the committee considers necessary to assist the governing board in carrying out its fiscal oversight responsibilities, including making additional requests of the authority to understand and address the findings from the forensic evaluation as appropriate and necessary to uphold the standards of good governance.
Thank you. Deputy Mayor, is it accurate to say that these edits are taking the concepts from the joint letter between our executive office and the mayor's office and capturing them as part of this resolution?
Absolutely.
Okay, thank you. Before I ask for a second for the motion for the amendment, are there any questions about these edits? Board Member Foster.
Thank you so much, Chair. Thank you so much, Deputy Mayor. I just want to ask a question regarding this component on the freezing of hiring positions and the exception that's there. And I just want to hold that up against some of the recommendations or potential actions that we heard rather from Clark Newber. So given that the agency does not currently have a CFO, if that was an action the agency wanted to take to look at hiring somebody into the Chief Financial Officer position, is it correct that we would need to move an exemption to this hiring freeze in order to take that action?
That is my read of it, yes.
Thank you.
Thank you. Any more questions? Okay, there has been a motion to move an amendment. Can I have a second?
Second.
Seconded. Should I do a roll call on this or can I do a voice vote on the amendment? Board Member.
And Chair, I just want to reiterate, as the Deputy Mayor indicated, I am supportive, even though it's my underlying resolution, I support the amendment.
So can we just accept it as a friendly amendment or how does it work here? Yes, okay, so. Go ahead, Board Member. Okay.
I was going to say, I'm happy with the voice amendment, like whatever you decide to do.
Why don't we just dot our T's and cross our I's and do all those in favor of the amendment to resolution 2026-04, please say aye.
Aye.
All those opposed? The amendment carries. We have now before us resolution 2026-04 as amended. Board Member Barone to close.
I urge your support.
Any final comments or questions? Okay. We have all those in favor of the resolution 2026-04 as amended. Actually, we're going to do a roll call. Yeah.
Chair Zahalai,
Aye.
Member Barone,
Aye.
Member Fain,
Aye.
Member Aviva,
Aye.
Member Rink,
Aye.
Member Surratt,
Aye.
Member Foster,
Aye.
Member Bracken,
Aye.
Member Hay,
Aye.
Member Prince, Member Prince, Member Backus,
Aye.
Member Jing.
Aye.
Chair, the motion has passed with 11 votes.
Okay, thank you very much. That brings us to the end of today's meeting. Are there any final comments or questions for the good of the order? Okay, is there a motion and a second to adjourn?
Motion. I second.
Thank you. With no other business to come before this meeting as adjourned. Thank you.